Hi friends, I am Narendra Singh Kharra. We are here for Indian Cyclothon, the fastest cycling event of Jaipur, powered by India Runners, which is organized on 15th April 2018 this month. Dr. Vikram Sharma, sports injury specialist, Fortis Hospital, head of sports medicine department is with us, and he will guide us regarding the injuries, possible injuries we can have in cycling. Welcome, sir.
Thank you, Narendra, and thank you, Prashant, for giving me this opportunity. So, I'm Dr. Vikram, and I'm head of sports medicine at Fortis Hospital, Jaipur. And so, in today's session, we'll be discussing about the injuries which can occur during the cycling and how to prevent that, something about the nutrition, and everything which we can cover about the cycling and the running also.
Yeah, sir. So my first question will be, what all are the possible injuries that can happen in cycling or running, and how to handle them without a doctor? So this we would definitely hear from you that what can be done.
Yeah, thank you, Nagin. Actually, as cycling is an outdoor sports, so there are so many injuries can occur during the outdoor cycling, as well as if you don't handle your equipment properly, there are definitely chances of injuries. So we can divide the cycling injuries into two types. One are the acute injuries. Injuries means the injuries which can occur as an emergency. So these injuries are like fracture, dislocations, head injuries, and the neck injuries. So whenever there is a collision, if you collide or if any kind of accident occurs, in that case, these kind of acute injuries can happen. So first injury can be a fracture or a dislocation. So whenever you see any of your colleague after a hit, and if you notice any kind of deformity, if you notice that the limb, either the leg or the hands, they are not in proper shape, that means the deformity. So whenever you notice any kind of deformity, that is indicative of any kind of fracture or a dislocation. So first thing which has to be done is to immobilize that deformed limb. Immobilize mean to make it stable. So how would you make it stable? To make it stable, you have to use any stiff thing. That can be a wooden piece, that can be a pillow, or anything which you find a stiff thing and which should be clean. So you can wrap that around that deformed limb, so you can shift your colleague to a proper hospital. The second, which is a rather serious injury, can be a head injury. So if there is a direct hit on the head of a cyclist, so that is a very severe injury, and in those cases you should not wait for any kind of first aid, and shifting to the hospital should be urgent. If you notice that any kind of loss of consciousness is there, then this is a very serious sign, and in those cases the shifting to hospital should be must and urgent. In cases of head injury, you should not wait for symptom to appear, because sometimes the symptom appears very late and you are not a qualified doctor at the instance. So before making any kind of final judgment, you should try to shift that patient or your fellow or your colleague immediately to the hospital. One more important thing when you deal with the neck injury or the back injury, which means any kind of spinal injury. So if anyone complains that he has a severe pain on the back side, and if you notice any kind of deformity over there, so that is again an indicative of any kind of fracture or any serious injury over the neck or the back. So in those cases, the shifting has to be very proper. Shifting means whenever you shift that person to any vehicle, any car or anywhere, so you should support the back first, and there should be at least 3 to 4% to shift that person to the proper vehicle to shift him before to the hospital. Another acute kind of injuries are like cuts, which we call laceration, or bruises, or any kind of injury which can occur when there is a collide to the road. So in those cases, to control the bleeding, first you have to give a compression. There has to be continuous compression over that cut, and that compression has to be given with a very clean cloth. If you have a dressing kit, that is best. But if you don't have any dressing kit along with you, then you can use the very clean cloth to give a compression. So compression is the first and the best adaptive tool which you can use during any kind of bleeding. So these are the acute injuries, and other kind of injuries which we can call overuse injuries. So overuse injuries are the injuries which can occur when you don't use your equipment properly, when your body is not flexible, when your muscle strength is not proper. So these kind of injuries appear gradually. Gradually means they appear very slowly. They are not acute emergencies. So Narendra, we can start with the body's upper part.
Yeah, so since I am a cyclist, so maybe I would like to know, during long cycling, first kind of symptoms we get is on hands, palms, and the shoulders become slightly stiff.
Yeah.
So what do you suggest for these kind of things?
Fine. So we can start with the upper part of body, and we can start with the neck pain. So if your back portion is stiff, and you have to always look on the front side, so there are definite chances of developing neck pain. So the common cause of developing neck pain is the stiffness, and whenever you have an increased thoracic spine curve. So whenever there's your chest spine is not flexible enough, your neck spine is not flexible enough, then there are definite chances of neck pain. And the remedy is that there has to be a proper flexibility. For that flexibility, before the cycling session and during the routine cycling, there has to be a stretching of your back as well as to your cervical spine. So that is the basic key thing about the neck pain. If you talk about the upper back pain, so upper back pain is again depend on toning of your scapular muscles, your shoulder stabilizer muscles. So they has to be strong enough, because you have to maintain your shoulder posture for long during the long bicycle rides. So your back spine has to be flexible, as well as this has to be strong enough.
So strengthening is also very important.
Yeah, strengthening is very much needed.
Stretching and strengthening.
Yeah, and for strengthening, definitely the scapular stabilizer strengthening, like trapezius and latissimus dorsi, they have to be given proper attention during the strengthening courses. If you join any kind of gymnasium or that sort of thing, so you should focus on the strengthening of latissimus dorsi, trapezius, and all the back muscles of your cervical spine also. The third common kind of pain, which is very common for a cyclist, is a lower back ache.
Right.
So for lower back ache, there are certain features, there are certain factors which affect that lower back ache. Again, the strengthening and the stretching, and the most importantly, your core muscle has to be strong enough. Because when you don't have a strong core muscles, you cannot maintain the normal curve of your spine. So there is an increased curve of your spine, of your lumbar spine, of your lower back spine. So whenever there is an increased curve, there would be definite chances that you may fall in a lower back ache. Apart from that, the hip muscles, there has to be a proper strengthening of a gluteal muscle. So if you have a weak gluteal muscle, your definite chances that your pelvis is tilt down upward.
Right.
So in that cases, the curve, your lower back curve increases, and that makes you prone for the any kind of lower back aches.
All right.
Apart from that, the knee pain is sometimes very common during the cycling.
Right.
So one of the most important and very common cause of knee pain is when you don't maintain a proper seat height. When the seat height is very low, there's too much bending of your knee. So the friction inside your knee would be increased, and that makes you prone for the knee pain.
Right.
So there can be a particular tendonitis. So there is a tendon in front of your kneecap. So there is a more rubbing on that tendon. if you have a low seat height. So seat height has to be appropriate. So as a rule of thumb, when you sit and you put your foot on the pedal axis, so there has to be an angle around 10 to 15 degree when your knee is fully extended.
Alright.
So that is a basic thing that has to be maintained. And during the mid position, your knee should not go forward to the pedal axis.
Okay.
So these are the two basic things which are needed. So a proper seat height is mandatory for the long cycling sessions, because if you have a low seat height, you are definitely prone for the knee pain. Apart from that, if you have a pre-existing knee injury, like if you have a meniscal tear, or if you have a ligament tear, or if you have any other knee injury, in those cases you are again prone for knee pain. So if you are recovering from any kind of sports injury, then there has to be a proper examination before entering to a cycling session. The last thing, or after knee, we can talk about the ankle and the foot. So if Narendra, there are different types of foot. So some are the flat foot,
Right.
some have some arches are bigger, and in some cases arches are normal. So we have different kinds of foot.
Right.
So if you have a normal foot, then it's fine, it's very good. If you have low arches and if you have high arches, then your cleat positioning may differ as according to the arches.
Alright.
And a simple test to assess the arches is wet test. So in wet test, you just wet your foot, barefoot, and you walk on the floor. So generally the tip,
Right.
and you don't get side part of foot impression, that means you have an arch, you have a high arch.
Right.
And if you have too much impression, that means you have a low arch. So that is a simple test anyone can do at his home. So in those cases, the footwear has to be maintained according to that. You can use a high arch footwear, or you can use a flat footwear. Apart from that, cleat positioning may also differ. Apart from that, as you have asked me about the numbness over the wrist.
Right.
So if you are a long duration cyclist and if your wrists are too much bent, if there is a far reach, like if your wrists are bent too much down, in those cases there are certain nerves which travel in front of your wrist, so there are definite chances of compressing those nerves.
Okay.
So as a result of that, there would be numbness over your wrist, over your hand, and we call it carpal tunnel syndrome. So if this condition remains chronic, means repeatedly if you put more pressure on the front side of your nerves, then there are definite chances that there would be something which lasts longer, which we call carpal tunnel syndrome. So the wrist should not be too much hyperextended, means this should not be too much extended on the backward.
Okay.
They should be on the level of your handlebar. So if your handlebar is too low, in those cases sometimes, and if you bend too much forward, in those cases there would be a hyperextension of your wrist joint. And some of the cyclists they have consulted me for like numbness in the pubic area, on the seating area.
Right.
So actually we have a nerve which we call a pudendal nerve. So if you go for a long cycling session, then there are definite chances that there would be a compression of pudendal nerve if your saddle is not proper. So if your saddle is not proper, then there are chances that you can develop a pudendal nerve compression. This is very common when your saddle tilt is upwards.
Okay.
So because saddle is like this, and when you sit, so there are more chances of a nerve compression.
Right.
And apart from that, just to avoid this condition, you can use padded shorts. So there would be less compression over the pudendal nerve. If you use a saddle which is very narrow, so and suppose these are the sitting bones, so you may sink your sitting bones outside your saddle.
Right.
So in those cases, again there are more chances of your pudendal nerve compression.
Alright.
If your saddle is very soft, So this has to be neither too hard nor too soft.
Right.
If you have a very soft saddle, then again there are chances that you will sink inside your saddle,
Right.
and the chances of pudendal nerve compression increases. So that creates paresthesia around your genital area, and some more complications may also occur.
Alright.
So that is it about the injuries.
And I mean, maybe if the injuries are not severe,
Yeah.
so then one should, how much time should, I mean, he or she take that he should visit a doctor or wait for
Yeah.
some more time?
Yeah, fine. So Narendra, in cases of acute emergency, definitely he has to shift to a doctor.
Right.
In cases of overuse injuries, he can wait, because sometimes the overuse subside with the rest. If you fall in a overuse and if you take a rest, then these injuries may subside. But if you find a long-standing soreness over your body, then in those cases this should not be avoided, because this may be an alarming sign before final injury. So these may be the alarming symptom. So in those cases you should consult your doctor.
Alright.
And if you have a like mild backache, so or if you have a mild neck pain, so they can subside with the proper stretching, and if you apply a heat or any kind of analgesic gel, and if you take rest. But in spite of after these measures, if these injuries do not subside, then you should consult your doctor.
Alright. And I mean, who should not attempt cycling or running? I mean, is there any condition where I mean one should not attempt cycling or running?
Yeah, there are certain conditions. Actually, Narendra, you are fortunate enough that you have adopted a very good sports, because cycling is a very good sports for your knee. Because cycling is a low impact activity, because you don't get a direct hit on your knee. As well as this is very good exercise for burning your calories. So cycling is a very good exercise to maintain your health, to maintain your muscle tone, to maintain your vital capacity, to maintain your psyche.
Right.
So I'd like to also share, maybe relevant or not, but we have a study that with the help of running or cycling, you can avoid or you can treat mild depressions as well. So your psyche get improves with these kind of activities. So you were asking me about that, who should not attempt the cycling.
Right.
So there are certain conditions, like if you are a cardiac patient, then in those cases there has to be a primary examination. If you have a very high BP, if you have asthma, in those cases there has to be a primary examination with your physician.
Okay.
But that does not mean that you cannot attempt cycling.
Alright.
So after ruling out these conditions, or after getting treated these conditions, and in these cases you should always have your medicines with your hand.
Alright.
Apart from that, if you are recovering any kind of injury, if you are recovering any kind of fracture, any kind of stress fracture, any ligament injuries, then there are certain return to sports criteria. So in those cases there has to be a primary examination with your treating physician or a sports medicine consultant, that whether you are able to take part in sports or not. So I think almost everyone can take part in cycling sports, but there has to be certain criteria which has to be fulfilled before that.
Alright. And I mean, anything I mean you would like to suggest regarding the nutrition part of I mean what should cyclists should take and
Yeah. So then, if broadly speaking, there are multiple aspects under the heading nutrition which has to be covered. So we'll talk about the basic nutrition. So basically there are three components of nutrition: the protein, carbohydrate and the fats. So there has to be a proper balanced diet. So you should take proper amount of carbohydrate, fats and protein. Why protein is needed? Because sufficient amount of protein is very much needed if you sustain any kind of injury, muscle injury. So you should take proper protein ingestion, because for repair of any kind of injury, sufficient amount of protein is very much needed. So protein should be there properly in the diet, apart from fat. And the most important thing which is needed for an endurance runner, for a cyclist, for a runner, or any kind of endurance runner or swimmer, that is carbohydrate. Because carbohydrate is the only instant source of energy which our body utilizes. Although our body stores carbohydrate also, but that is something not infinite.
Right.
So that stored carbohydrate can be used in cases of emergency conditions, but that has a limitation. Our liver stores that carbohydrate. So the carbohydrate diet has to be proper. So we have two kinds of carbohydrate. Some of the carbohydrate which has high glycemic index, which create sudden increase in your carbohydrate in your blood sugar level. And other carbohydrate which can be stored as a carbohydrate reserve inside your body.
Okay.
So carbohydrate again, they can be taken in anything which is sweet, the chocolate milk or the starchy foods, that can be in the rice, in the pasta, in the breads, in the potato. So all these kind of foods, they contain carbohydrate. So there is a concept in the endurance runner which we call carb loading. So carb loading ideally has to be started at least 3 to 4 days before the event. So you should take the low glycemic index food like the starchy foods, the rice and potato, everything. So enough amount of carbohydrate should be stored inside your body.
Right.
Just before your competition, sufficient amount of carbohydrate has to be taken. If the competition goes more than 1 hour, 2 hours, 3 hours, then with the repeated intervals, sufficient amount of carbohydrate that can be in the form of anything which you can eat or any drink. That has to be supplemented. Apart from that, at the time of competition, proper electrolyte ingestion is very much needed. Because if you are sweating too much and you are just taking a plain water, then there can be deficiency of sodium, the salt content inside your body. If you just take water, if you don't take salt along with that. So sometimes this is a mistake which some of the endurance athletes do, that whenever they feel thirsty, they just start taking water.
Plain water.
Yeah, they don't add any salt or anything to that. So in those cases, if you are taking water, that is fine. But in between, you can take any salt supplementation. You can use salted peanuts or chips or anything.
Right.
So salt supplement has to be there. Coconut water again is a very good source of potassium also. So that can be taken along with that. So I think these are the basic things about nutrition which has to be covered.
I think you have provided a lot of information regarding injuries and nutrition, and it was a nice session that it will help the cyclists, the runners, all the people who are doing endurance sports.
Yeah, thank you. And Naren, I would like to cover one thing also, that in cases of acute injuries, like if you develop any kind of ankle sprain or any kind of knee sports injury, so first you should look for that whether there is any kind of swelling or not. If you sustain any big swelling, that means the injury is severe, and in those cases you have to follow a RICE protocol. RICE means rest, ice, compression and elevation. So in any kind of acute injury, there should not be any heat application to the injured area. Always apply ice to that injured area. You should immobilize that with the help of any kind of bandage, that can be a crepe bandage or any kind of other bandage, and rest has to be given if you suspect any severe injury, and so that is the RICE protocol which has to be followed.
And the injury part should be kept elevated.
Yeah.
That's the
Rest, ice, compression and elevation.
Right.
Yeah. So yes. So injured part has to be elevated above the heart level. So just to avoid the swelling. So RICE protocol is very much, we should know about that. So that is it.